Well, there was a slight drop in new COVID cases today. 452 new infections reported, with up to 351 of those infectious in the community for part or all of their infectious period. A woman in her 70s who passed away in hospital has become the 113th death in the state since the start of the pandemic. Today, the Premier offered a small glimmer of hope that a return to normal could be on the way.
Life will be much freer than what it is today once we get to 70% and 80%. It doesn't mean that we will let the virus be rampant in the community no matter our number of cases, but it will be freer than what it is today.
It comes as some of the city's biggest hospitals scramble to contain COVID outbreaks. Here's Ruth Wynne-Williams.
4 patients and 2 staff have tested positive here at St George Hospital. This outbreak is centred in the oncology department. 21 patients are considered close contacts. They and a number of staff are in isolation today. We know the 2 staff members involved are fully vaccinated. 2 patients have had 1 jab and 1 other patient has had no vaccination at all. Officials are watching this site very, very closely, and this morning Brad Hazzard explained why.
The result of that, just in that one fairly small case, has taken out 80 health staff for the 14 days quarantine. So I think that's fairly indicative.
A number of other hospitals are also dealing with outbreaks today. RPA has confirmed a staff member worked for 4 days while infectious with COVID-19. Staff and patients in the radiology department are today in isolation. They are considered close contacts, but the good news out of there is that there has been no confirmed transmission. Nepean Hospital is another site also dealing with an outbreak of its own. That's been bubbling on for a number of days. At least 30 people have contracted COVID-19 at that site. Health officials are watching these hospitals very, very closely. These outbreaks affecting such a large number of critical staff and some of the most vulnerable in our state.
Cases are rising in regional areas too. 18 new cases in Western New South Wales, 16 of those in Dubbo. While that's half of the number of new cases from the day before, authorities are warning locals not to be complacent.
That's a drop that is a short-term signal. I wouldn't certainly take it as though we're on top of this or we're going to see continued decreases in coming days.
Cases in Western New South Wales now sit at 116 in total, with record numbers of people coming out to get tested. 5,000 tests administered in Dubbo alone. There's also been a case at Broken Hill, and that will be included in tomorrow's numbers.